Do you ever get that deep, hoarse voice that comes and goes? Well, maybe it's time to go to the doctor. Hoarseness isn't always something simple, but could be an early sign of a more serious condition. We spoke to an ear, nose, and throat specialist, Dr. Michael Gatto of Desert Regional Medical Center in Palm Springs.
Hoarseness comes from an abnormality of the vocal cords or the larynx, so it's a change in pitch or sound of the voice. One of the reasons why people get hoarse is aging, and as we age, the vocal cords will atrophy and the voice deepens. That's one of the primary causes in an aging population. Other reasons could be acid reflux. That's a very common diagnosis in this day and age, and it's another aging problem with problems with the esophagus, allowing the acid that the stomach secretes to remain in the stomach. And what happens is this acid works its way into the throat, and it causes a constant irritation of the throat and the larynx. That's a very common reason for hoarseness in this day and age. Reflux, people have the interpretation because of commercials that this is a stomach problem. It is not necessarily a stomach symptom. And most of the people that come into my office have problems with throat. And we have this very specific term for that. It's called laryngopharyngeal reflux rather than GERD, which is gastrointestinal. That would give you either a cough, a throat clearing constantly, and sometimes irritation, burning, and hoarseness. And that's diagnosed through very specific tests in which we basically look down the throat with a scope, and or we have now a pH monitor in which a patient wears a catheter for 24 hours, and it's very precise in how much acidity is in the throat, and that's treatable. Other funk factors that could happen, you could have thyroid malfunctions, which do cause hoarseness, and or allergy problems, which people get a considerable amount of mucus in the throat, and it can cause a problem with the larynx and give you a deeper voice. There are some serious complications to hoarseness which can arise, and one of them could be a vocal cord paralysis. And people that sometimes have a real weakening of their voice, and their voice gets very breathy, and it's a sudden onset, it could be that one of the vocal cords is not functioning appropriately, and it could be a paralysis. That, in 75% of the time, is what we call idiopathic, and there's no diagnosis made on that. In 25% of the time, it could be such things as viral, or it could be something such as cancer. In a smoker, hoarseness is definitely something that needs to be looked into because you're looking at cancer of the vocal cords, which is one of the most common diagnoses in a person that has smoked for a long period of time.